Hello, everybody, and thank you for tuning in to the Liberty Report. With me today is Daniel McAdams, our co-host. Daniel, good to see you.
How are you this morning, Dr. Paul?
Doing well, doing well. We're going to solve another problem. That's all we have to do.
Another day, another
we solve
problem.
one problem. Either we didn't completely solve it or a new one comes up. But most of the time, it's a repetition of the same thing, especially trying to get everybody to understand to the best of their ability just exactly what's going on and who should be wearing masks and a few other things like that, and who's sick, and how do you do this when there's a lot of statistics out there you can't even believe, you know, and they're changing them. But I tell you what, all of a sudden, you know, there was Fauci was losing a little bit of momentum.
Yeah.
He was out of the limelight, and the president looked like he was getting cool to him too. Yeah. And but of course, Fauci has been the instigator. If there's ever one person whose face is out there for trying to instigate hysteria and all the fear mongering that went on. And yet things look better, and we've commented on it, and the country's commented on it. But all of a sudden, there's more news right now, and Fauci's in there, and he's talking about it again and getting a little bit of attention. He was saying that you know, he never realized that it could be this bad. He says it's his worst nightmare, and it's coming back again. And he also said that he is still referred to from Politico and other mainstream, the expert. They don't qualify it at all. They just say he is the expert, and he's the only, the media, he's really been the only expert. And then, of course, when you dive into a little bit of his background and how many great medical things has he done, you know, it's very marginal. So it's all been a gimmick. He's been used. But I think what this means to me is that they had to get him out talking about that to scare the people. That meant there was some real progress in diminishing the danger of the COVID-19. You know, and they had to stir up this trouble, and I imagine they have, because they even went after Texas today. Texas is just exploding with cases, and you know, so thank goodness we started to move in the right direction, and. They're talking about all these new people put into the hospital, not just in Texas, but they were listing 10 states there, that tremendous number of new hospitalization. But I think there's some explanation for that. I think it's a little bit of catch up, you know, that people, they say this, they're admitted for the virus, but they told us that a lot of people died from the virus, and they were lying about that, and they just throw it out there. But I think it's related to lockdown, is the fact that there's some catch up, because so many people were denied medical care, and they were considered, you know, no emergency, and they put them on wait. And now I think they're coming back in and getting their elective surgery. One person apologized for using that term because it was sort of challenging. He shouldn't even have the surgery. Yeah. But anyway, I think the news, and with Fauci in the news again, there's a sign that if you take everything they say at face value, we all should be shaken again. But I don't think they're going to be able to do that. Not when you see the people just loving to be able to go out and walk, and people showing more with, you know, I went out there, I just went to the store, and nobody wore a mask and this kind of thing. So people are realizing that it's better than it was. Whether they're going to be able to resurrect the fear and the terrorism attitude about this, I don't know. I hope they aren't successful, because I think there's a lot of problems, but they're nothing like they'd like it to be. It isn't. If it's Fauci's worst nightmare and he's discredited, then I think we'll be okay.
Yeah, it's, you know, the mainstream media just thrives on this, and again, you do have to wonder about the political component, the political context. You know, it seems like just yesterday we were in a mass panic over the civil war that was breaking out in the U.S. and the horrible things that were happening. And then a week before that, we were all panicking about coronavirus for 3 months. It's like they have to keep this level of panic ramped up completely. And so now, when all of a sudden, you know, they had the funeral yesterday here in Houston for George Floyd. Now that's kind of dying down. They're no longer burning down buildings and stealing TVs. So what's the latest? We got to bring out Fauci. It's kind of interesting that Fauci, he was speaking to a Biotech Innovation Conference, and that's where these remarks were taken from. These are the people that are going to make billions of dollars off of a vaccine. So you can guess what side Fauci comes down on. But a couple of the comments that are worth repeating, he said, in a period of 4 months, it, meaning coronavirus, has devastated the whole world, and it isn't over yet. And it's interesting, you think about coronavirus devastated the whole world. I think a good argument could be made that the reaction to coronavirus devastated the whole world. Because places that didn't shut down and destroy their economies, they're not really devastated. Even places like little old Belarus up there next to Russia, he didn't shut anything down, and they have one of the lowest mortality rates ever. Even Sweden, with its big problems dealing with older folks, they still didn't have a level anywhere near the UK and many other countries. But let's think about devastated the whole world. I was looking at the World Health Organization's website, thinking about what does it mean, devastating the world. And there's a first graphic up here, Dr. Paul. It's interesting. This is from 2017. Up to 650,000 people die of respiratory disease linked to the seasonal flu. Okay.
Each year.
Each year. And then hit the next one. This is just today from the coronavirus statistics. 414,826. So we're still, 200 and some thousand deaths lower than the each year that the WHO tells us, yet somehow it devastates the world. That's not to detract from each one of those lives, of course, is a tragedy that's taken away. But if when you compare the two, how can you say it's devastated the entire world? It's very it's scare stories.
The variable, you already mentioned it, I think it's important, it's the lockdown.
Yeah.
It's lockdown, people. So if that's the only significant variable, you'd have to admit there's a difference, because we were having a lot of deaths before, and right now, a lot of the deaths that would have been from the regular virus, that might be all thrown in with coronavirus right now because of the lack of testing. The testing is not very relevant, and some of these cases that they're finding right now is the fact that they're doing more testing. And anybody who's positive, they're marking down as having coronavirus, even though they've never been sick. What if they treated all colds this way? Yeah. Good Lord, look at how many people have died from other reasons because they had a cold. Yeah. They don't blame the cold. Yeah. They say, a person that had severe diabetes had a cold and got checked out and died eventually. It's coronavirus or whatever. Yeah. So they have a game they're playing. They have a goal. You mentioned it already. There's a financial goal in this. There's medical prestige that people seek. But it's the panic and it's the destruction. There are some people in our society, and we're seeing this especially with the riots occurring, with the killing of the policemen, and that is social upheaval. People want social upheaval because they have a goal, both an economic and a social goal of sort of a Marxist system. And as long as they have any excuse, they're going to use it to stir up trouble and get the people very excited and very angry, and also for people to lose their senses. Yeah. They become delusional, and certainly I think we saw some delusion associated with the last several months.
Delusion is right. It's also interesting that Fauci was reassuring these industry people, don't worry, you're going to make a few bucks, and we touched on it earlier, but here's what he said. Industry is not stupid. They figured it out. SARS had a degree of transmissibility that it burned itself out with pure public health measures. No way is that going to happen with this virus. He's almost like he's assuring them. And later he said that, yes, the vaccine industry is a profit-driven industry. He reassured all of these people they're going to make some money. The other thing interesting, Dr. Paul, we talked about the WHO and the asymptomatic transmission of the disease yesterday. Well, Fauci chimed in on it. Unfortunately for Fauci, he chimed in before the WHO itself backed off of its own report. And he said, and what he said was probably pretty reasonable, because he essentially backed up what the WHO doctor said, who was pilloried for saying it. He said, although there are asymptomatic infections, they are not the drivers of this outbreak. The drivers are the symptomatic patients who pass on the disease. Of course, that again raises the issue of the mandatory masks. So he sort of agreed, and then the WHO backed up off of it. But we should get into Texas a little bit, because you touched on it, and it's important because the headlines are everywhere. big flare-up in Texas. The Houston Chronicle is having a field day. In fact, we can even put up that next JPEG. Texas COVID-19 hospitalizations up 36% since Memorial Day. A total scare headline, the Texas spike. But when you look a little bit down past that, Dr. Paul, it's kind of interesting. This is from the same article. Just go down a couple paragraphs. Over the past 7 days, Texas average has been 1,877 hospitalizations per day. Tuesday, which is yesterday, it went up by about 180. Okay, we don't know. As you suggested earlier, we don't know what that 180 is. They say it's all COVID. We don't know. But all of a sudden, 180 more people in the entire state of how many? 20 million people, and it's a huge Texas spike. And in fact, if you want to really look at what's happening in Texas, it's a little bit more clear if you look at the next. This is Texas daily deaths, and it's following a normal trajectory of tapering off toward the end of its life. We're not seeing, despite what the headlines say, Dr. Paul, we're not seeing a Texas spike like they scare us.
I think they admit it, that the testing has a lot to do with statistics. If you don't test anybody, and a lot of people were asymptomatic, they know that, but a lot of people had symptoms, but they didn't go to the doctor. A lot of people do that. You know, they have a bad cold and chest cold and wait a couple days and they get better. But now with this forced testing, everybody has to get tested or you can't go to school. Pretty soon you won't be able to get a driver's license and all this other thing. So the test increased the number of findings because some of them might have said, yeah, I had a little cold, I had a cough and sneeze like that. And you have it.
Yeah.
So you know what it's encouraged? Because I've noticed a few friends and neighbors and others who had to go place and they will ask questions. And they say, their answers are always no.
Yeah.
Because everybody knows that it won't be helpful to anybody. It won't be helpful to the patient, and it won't be helpful to anybody else. And all they're doing is trying to put you on a list, and so that you can follow. Can you imagine what it's going to be like about, have you been immunized? Like, oh, well, you have to prove you're immunized.
Yeah.
That will be your passport. So we have a long way to go to work on prevention of this. This is right now we're concerned about an extension of the fear-mongering, and hopefully they're unsuccessful, but long-term they're going to be there, and they have the power of propaganda, the major media and the government so often that they can stir up a lot of hatred, and if you deny people something, I'll go along with it. I have to admit, since this 01, I've hated going to airports, but I've gone to the airports. I mean, so I feel badly that I wasn't able to figure out a way to get around going to airports. So it's criminal. So there's going to be a lot more of that. But in my mind, I've sort of accepted the idea that I probably won't get to travel much because I don't think I can take it.
Yeah.
Unless somebody sends me an airplane.
That's right. Send Dr. Paul an airplane. There's an idea.
And a pilot.
Well, you could do some of that yourself.
Yeah, a little bit.
But you can't, we can't ignore the political component of this. We just can't. Of course, we'll be accused of being apologists for Trump, which we are not. But you cannot ignore the political implications. The last thing that the Democrats want to have happen toward the end of summer is for the news to be the economy is recovering, people are out and about, their lives are getting back together again, they're feeling happy again. That's the last thing they want politically. They don't want a good news story. And I just can't believe that it's a coincidence that all of this new ramped up of the hype and the scare didn't happen just the day after President Trump announced that he's going to start up rallies again, because that is his most effective way of communicating with people. They were in huge stadiums, hundreds of thousands of people came. It was like a rock concert, and he's very good at whatever you think of his policies, and we've been critical for the past 3.5 years. But whatever you think of that, he's a great communicator in that kind of situation. He's announced that he's going back to it as his numbers are getting a little wobbly, and next thing you know, oh my gosh, there are spikes everywhere. How dare he do this? He just wants to kill people.
There was one Democratic staffer. We don't know his name, but he was probably a very important staffer.
Oh, yeah.
And he said that this whole endemic, this whole thing on coronavirus is just getting started.
Oh.
just getting started. And I keep thinking, you know, I do use that term once in a while because in many ways, I think the correction that is going to be required from our insane monetary and spending policy, the huge debt, is just getting started. Yeah. And that would be more appropriate. But they want to talk about concentration on this thing just getting started because they don't want to mess around with, oh, you mean I'd have to back off a little, live within my means, and maybe too much spending is bad, and maybe debt is bad? No, they don't want to have any part of it. But I happen to think the term is right, but they're applying it to the wrong problem.
Yeah. Well, you know, we have an obligation to report the news, Dr. Paul, and I think the next story is pretty interesting and pretty important to talk about. And this, again, comes from our good friend Bob Wenzel at Target Liberty. He's been helping us out this couple of weeks with some good stuff. But this is a new report from the World Health Organization, the top experts, the guys that are telling us you got to wear a mask. And here's the next, this should just give you a little flavor of, just to show this is official, Dr. Paul, advice on the use of masks in the context of COVID-19. Well, Bob spotted some very interesting justifications for wearing a mask in this report. Now, listen to a couple of these, Dr. Paul. Potential benefits and advantages. This is the WHO. This is the science. The likely advantages of the use of masks by healthy people in the general public include reduced potential stigmatization of individuals wearing masks to prevent infecting others. Reducing the stigmatization, making you feel better about it. The other thing is, amidst the global shortage of surgical masks and PPE, encouraging the public to create their own fabric masks may promote individual enterprise and community integration. It's a feel-good. We'll sit together and sing Kumbaya and make a mask together. Moreover, the production of non-medical masks may offer a source of income for those able to manufacture masks within their communities. This doesn't sound very much like the science to me. They go on to say, fabric masks, you'll love this, Dr. Paul, can also be a form of cultural expression. Isn't that nice? Encouraging public acceptance of protection measures in general. And the social and psychological acceptance of both wearing masks and not wearing masks in different kinds of countries. So basically, they're talking about the fact that it will encourage countries and community adopting policies that will make you feel better about wearing a mask.
And that's not real good medicine. It's not good science. It's not good politics. It's not good liberty issues. But I think they do have a goal doing this. They want us to get used to obeying as an issue of power. And this is this sort of blends in with what we were saying. They have to restart the crisis. So we're losing the momentum. People are taking their masks off. What are we going to do? So they have to have the crisis, and they want control, which to me fits the scenario, which I think is becoming more self-evident all the time, and that is, this is not like 1975 or whatever the last virus was. This is preparing for permanency, and they've said this is going to be permanent. So this whole idea of the mask is you even do it when it doesn't do has nothing to do with your health. I mean, you know, this is a great symbol of obedience to the government. It's sort of like bending a knee to the authoritarians, just will do whatever you say. And some people do that. Some people I feel sorry for because they're really good people, and they say, well, you know, can't agree with it, but you know, we have to have law and order, and I have to obey my government and all, and they get all twisted around. But that is tragic. That's why the people you have in your government, or the power that government has, should never have been granted, because the people would be good, but you're not going to get enough good people in government to do the right thing, because they're always tempted to abuse it. So we put people in because they tell us they're going to be good people and protect our liberties and take care of us and not fight wars and all these kind of things. We'll balance the budget, but they don't do it. They get in and do it. So ultimately, this whole mess that we talk about, whether it's the virus or tearing up and the stores and stealing and mobs running around, it's the whole thing is people are sick and tired of this, and we have to get people, to do their best job, and we try to do our best job in presenting information. But I tell you what, people who are confident that it's just a issue of better politicians, I have a message for you. I've been there. I've met some nice people, a lot of them very sincere and well motivated, but there was a big percentage of them that they weren't well motivated, and they used the other people just to maintain power. And of course, the longer you're there and you're sucked into the power struggle and the money and a good job after you leave Congress, that their interests are not protecting your liberty and my liberty. They're not worried about our First Amendment rights. They're not worried about the Second Amendment rights, and they're there. So the solution is, and the founders were close to it, is put some restrictions on what our government should be doing. And thou shalt not is in the Constitution. The government can't do this, can't do that, can't do that. The people have to do this. And if you're going to have government, it's going to be local and close, but not to have a huge federal government, let alone an international government. So much of this stuff is international. You know, this WHO stuff, and who is this WHO anyway? Yeah. I think that I think the problem is we have to look at the individual problems and make a suggestion and try to interpret it. But ultimately, the ultimate solution, even in the monetary issues, is taking away a lot of power from the government and let the people work things out, and of course following the rules that we all know about, and there's no lie, cheating, and stealing. And under those conditions, the people can take care of themselves. Because man is imperfect, why would we want to put in charge of us and arbitrarily do this junk to us all the time? I was going to use a whole bit worse word than that.
What you were just saying about people in power reminds me of that great documentary on Thomas Massey, our good friend and certainly the best member in the House, who talked about that little pin as my precious, as the Lord of the Rings, as the ring. And he says, I always have to be careful and keep in mind that the danger of getting too attached to that. But, you've talked a lot now recently, a good little talk about resisting the mask and resisting all the social distancing in this. But I'm afraid I got some bad news for you, Dr. Paul, in my closing. And hearing what you had to say does not make me very happy. And I think we have to put up the last clip, because this is really bad news, Dr. Paul. I mean, people who ignore social distancing rules may have psychopathic personality traits. We finally found out what's wrong with us. This is a new study, and it's peer-reviewed, Dr. Paul. Pavel Blagov was surveying people about their habits during the pandemic, and he asked them personality-based questions. What did Blagov discover? He found that people who exhibited more psychopathic traits, like meanness and lack of restraint, were more likely to disregard policies like social distancing. He said, I knew that traits from the so-called dark triad, narcissism, Machiavellianism, and psychopathy, as well as the traits subsumed within psychopathy, are linked to health risk behavior and health problems, and I expected them to be implicated in health behaviors during the pandemic. So there you have it, Dr. Paul. Next stop is going to be psychiatric prisons like the Soviets had, because if you don't put your mask on, obviously you are psychopathic. We need to have psychiatric prisons for everyone, re-education camps. We joke about it, but it's not that funny.
Boy, you've really given me a job, because, we're supposed to end with something a little bit of upbeat, but this is a real challenge. Here you are explaining and scaring me, because there are a lot of fascists out there, and that's a fascist statement, and too many people going along with it. But I'm still okay. I'm still okay, because I still meet people in the neighborhood and on the streets and where I go, and if I go to a campus or talk to somebody on the phone or talk to anybody that views my program, I tell you what, there's a lot of good people out there and understand that. Our voices just are not being heard, and they know that, and they have control. So the big issue is who controls the final editing of the social media, and that's a big problem. And who who controls the government message. That's been going on for a long time. So, but I do meet a lot of people, and if you get depressed about who's in Congress, go and read Thomas Massey's page, because he is truly a real patriot and understand what's going on. And there are others too. But the one thing is no matter how authoritarian a government is, they cannot control ideas, and ideas have consequences, and ideas whose times have come cannot be stopped. Sometimes it comes a little slow, and sometimes there's frustration, but the ideas can permeate through a system. And actually, as bad as it is with social media, the media is still helpful to us. It's available. And we're going to have a lot of smart people out there, and they're working on it right now and preparing for the day where we all get blackballed on the regular social media network. And somebody's going to come up with this. I don't think they can close it down. But the big problem is, I mentioned it before on economics, you have to rectify the problems of the past, because we haven't, this whole thing is an imaginary problem, an exaggerated problem when it comes to coronavirus and some of the other things. But on the economic things, we have some bad things ahead for us because of the correction that has to happen. So these ideas are very, very important, and they're out there, and we do visit with a lot of people. We know a lot of people at the Mises Institute. You can't imagine how much good that they have done. And we refer a lot to Bob Wenzel. He reaches a lot of people. He himself doesn't even know how many people he reaches. We have no idea. Yeah, we watch our numbers, how many people look at this program, but maybe some of you have sent it to somebody else and read it. So we think ideas are important. We think the ideas are available. I'm convinced that young people, when they hear the truth, are pretty automatically inclined to think, I sort of like that idea. I like the idea of self-ownership and self-responsibility. And they would say, yeah, I sort of like the idea of keeping everything I earn, and that we wouldn't have an income tax, and we wouldn't have a conscription, and we wouldn't have all the authoritarian approaches, and I'd like to, own a gun if I think it's important. So no, it's out there. Our message is not being heard like it has to be in order to bring about change. But the one thing on our side is the system we have, whether it's foreign policy, domestic economic policy, or some of this social policy. I tell you what, it fails. It's failing, and that's what we're seeing. That's why we're in the midst of a bankruptcy, moral bankruptcy and a financial bankruptcy, which is opening up the doors for a new idea that might replace it. No more tinkering. We can't tinker and send 10 more people to Congress and think we're really going to change things. We need a lot more of that. So if nothing else, introduce your kids to these right ideas. Try to get them into the right schooling program that'll teach them these issues, and that's going to do more good on the long run than thinking that what I need to do is, lobby my congressman and or join the lobbying group and get representation. But anyway, I still remain the optimist in spite of what we talk about. But I've found out that if you try your best to tell the truth, it's an optimistic message, because you identify the problem and you identify what you can do with it. And that is sort of what we learned in medicine. Identify the problem, make a diagnosis, explain it to the patient, and then offer the care. And even before they get the treatment, they become more optimistic, and I think that's what we need. Right now, I think we should become more optimistic, because the programs are available. We just have to work a little harder, and we need expansion of support, and that's why we're delighted when you can send more people our way to watch our program and spread this message. Peace and prosperity is what is our goal. I want to thank everybody for tuning in today to the Liberty Report. Please come back soon.